that the number of people in hospital with flu quadrupled last week. New NHS statistics just out say 5,074 people were in hospital in England with the virus on the 29th of December. That is 4 times more than a month before on the 29th of November. And last week, there were an average of 4,469 flu patients in hospital each day. That's 3.5 times higher than the average for the same time last year. The Health Secretary, Wes Streeting, says social care reform would ease these problems.
The winter crisis we see in the NHS is exactly why we need to grasp the nettle of the big long-term reforms to social care that's needed, because as well as our 10-year plan for the NHS and all the reform we're doing there, we also need to reform our social care. One of the reasons why we see A&E departments so busy is because we can't get people out of hospital beds back into the community because of a lack of social care.
Well, our health correspondent Ashish Joshi joins me now from Kingsmill Hospital in Nottinghamshire. So a really significant jump in these figures, Ashish.
Yes, that's a huge rise. In the words of a senior NHS health leader, the figures for flu have skyrocketed. We saw the beginning of this trend a couple of weeks ago when we were reporting on the number of flu cases. We haven't reached the peak. That will probably be in the next week or so. But there is some concern that so many people have been hospitalised with flu, and among those we've had hundreds of people in critical care with flu, so 211 patients a day in these hospitals with flu in critical care alone, and those 5,000 patients a day taking up hospital beds. You heard the health secretary there talking about social care. Some people at home might be trying to figure out how social care impacts flu and why that adds to the pressure in hospitals. It's simply because if you have pressure in one part of the hospital, it builds up in another part. We had 11,000 patients who were medically fit for discharge in hospitals but couldn't be discharged back into the community because there were no social care packages in place. That means they have to stay in hospital, and if they stay in hospital, those beds don't become vacant for other patients who are arriving. They have to stay in ambulances. Those handovers are then delayed further, and that pressure continues to build. But essentially, what is happening with the flu season, it looks like a decision taken by the government to delay the vaccination, the adult vaccination programme, which normally starts at the beginning of September, was delayed to October to try and increase the immunity in the community throughout the winter. It looks like that decision might have been the wrong one, because in this case what has happened is flu season arrived early, more patients infected with flu, becoming sicker, fewer people immunised, and less immunisation within the community. So that will need a serious looking at, the decision to delay the vaccination programme. But certainly, if you look on the NHS website, the vaccination programme is still open, but anecdotally we're hearing that patients are still struggling to get their flu jab. But then that will take another 2 weeks to really kick in and give them the protection they need from flu. So all sorts of reasons why this flu season has been particularly bad. It's arrived early, the vaccination programme was delayed, and then we have the pressures in the system already. A very busy New Year, very busy Christmas period. And don't forget, Jane, we also, as well as flu, we have norovirus, RSV and COVID, that quademic that NHS health leaders have been warning about. They're all playing a significant part in adding to the pressure in hospital and ambulance trusts across the country.
And Ashish, you touched on social care, the government making announcements about this today, but the reform that they're talking about is an unlikely to make any difference, unlikely to be implemented for 2028. And as you said, this is a factor that's affecting overcrowding in hospitals now.
Yes, absolutely right. That is the criticism that's been levelled at the government. The announcement today, the National Care Service, everyone accepts, it doesn't matter who you talk to, what party they belong to, or what part of the health service they work in. Social care has to be fixed in order for acute hospitals like this one to work properly. Social care is really the one part of the health service that has been neglected and underfunded for so long. The government has now announced that there is a review. They've appointed somebody to have a really good look at social care, who will then respond directly to the Prime Minister. So they're trying to speed up the process as much as they can, this review into social care. But like you said, Jane, this report won't be finalised until 2028. An interim part of this report will be produced in 2026, but that's still a couple of years away. In the meantime, the pressure that poor social care, the lack of social care, that will continue to impact hospitals and continue to impact the way patients are taken into hospitals, kept in hospitals, and then essentially how they are discharged into the community until those social care packages are in place. And that needs proper funding more than anything else. And that's why a lot of governments previously, the previous government and previous health secretaries have been reluctant to commit to the cost. The Treasury will always say it's costing too much, and then the Department of Health will say, well, we need the social care to work so that people can be fit to work again. So there is an overall cost to the economy, but in the long term, that's a benefit to the economy. But that is such a difficult one, for the battle between the Treasury and the Department of Health about how much it will take to fix social care. But certainly the announcement today, we'll hear more details from Monday and into next week about not just social care, about the government's elective care programme, how it attempts to tackle the crisis in the NHS. But the criticism, as you said, is that it looks like they have now again put social care to the side and said we'll look at it in the next 2 years and in the next 3 or 4 years' time. But many people are saying it needs to be addressed right now.